One of the common challenges moms have with breastfeeding at home in the first couple weeks is engorgement. Engorgement happens when the mom's milk supply is becoming established and the breast can feel really swollen, firm, and uncomfortable. Ways to manage this at home would be to use a warm washcloth or a heating pack prior to feeding for a few minutes on the breast, and really massage the breast before feeding. Pay close attention to the areas that are firm or hard or feel like a lump in the breast. Those might be clogged milk ducts. Massage, massage, massage. While baby's feeding, you can continue massaging, and after the baby's done feeding, you can use an ice pack or a cold compress for a few minutes to help with the inflammation. If you're still feeling uncomfortable after doing these remedies, you can use a pump or hand express for a few minutes just to relieve some pressure. We don't want to overstimulate, so we don't want to create an oversupply, but it's okay to pump for a few minutes to relieve pressure. We just want to soften the breast. If you're still having trouble, if you're trying all these things at home, it's getting worse, you start to have flu-like symptoms, the breast is getting red or warm, these could be signs of mastitis. It would be unlikely it will turn this direction if you're following the right remedies at home, but if it does, it happens, call your provider right away. This is something that would require treatment. If occasionally a baby will have a hard time latching onto an engorged breast because it's so firm that a mom has a hard time compressing the breast down to get a deep latch. If this happens, it's okay and it's normal. Express a little bit of milk before feeding. Just hand express or use a hand pump or an electric pump. Get a little bit of the milk out of the breast to soften the breast so that you can latch the baby deeply onto the breast, and it's a little bit easier for the baby.